We're talking about cervical cancer, all you need to know about testing yourself. And of course, this whole month is cervical cancer month, right? Yeah. And we did say that a maternity midwife will be joining us. Akua Oduraa, I'm going to call you Daddy for this morning. So it's going to walk us through everything that we need to know. Good morning, Akua.
Good morning.
How are you?
Very well.
Thank you so much for being with us.
Thank you for having me.
Now, what is cervical cancer for those who are just hearing it for the first time?
Okay, so cervical cancer is cancer of the cervix, and it is caused by the high risk of human papilloma virus, a persistent high risk. And we're saying high risk because we have different kinds of the viruses. We have the high risk type and the low risk type. And we're also saying persistent because it can be there for between 10 to 15 years before the cancer comes about. That's how come we're saying that it is caused by the high risk type of the human papilloma virus. So, okay, that's it.
So what do we have here with us?
Okay, so a lot of discussions are going on because it's Cervical Cancer Awareness Month, and I just wanted to walk us through basically the screening methods and to also take the fear that people entertain away because hey, they will insert something, they will do this, and so it scares people. Yes, so I just want us to go through the few screening methods that we have. And so first of all, we have the HPV DNA testing.
Okay.
So HPV DNA testing, we're talking about knowing the presence of the virus before it even causes the disease.
Wow.
Yes. This is sort of an advanced kind of screening.
Okay.
Yes. And fortunately, this kind of screening, you take the sample yourself. You don't need to come to the hospital.
Nice.
So even in the comfort of your home or office, you can be screened. Because we are getting the working class people finding it difficult coming to the hospital for the screening to be done. So now we want to bring it to your doorsteps. And then we have the pap smear. The pap smear actually detects early diseases. You know, when the changes occur in the cervix, then the pap can pick it. And then we have the VIA, that's visual inspection with acetic acid. And with that one, it's a basic kind of screening. And when you apply the acetic acid and there's a change, meaning it's visible to the eye, that's how come the acetic acid will pick it. And then the colposcopy. Colposcopy is just like a microscope which magnifies the cervix for us to see if there's a lesion, which area the lesion is starting from. And so basically these are the kind of screening methods that we have.
In the colposcopy, if you see a lesion, doesn't necessarily mean cancer has begun.
We will take a sample and then take it to the lab. In all this, we have to take samples, take it to the lab, and then get to know, because we have so many types of the HPV. So even if it is positive, what type? Because the low risk causes genital warts and the high risk causes the cervical cancer. So we want to know what type the person is presenting. Is it also a cancer from the inside uterus, which is the endometrium, which has spread to the cervix? So one be sure exactly what's happening.
Yeah, you said genital warts. Is that benign or malignant?
It's benign, depending. It's benign, mostly. Yes, and then we treat it. Sometimes, depending on the stage, either we have a chemical we can put or apply on, and then it will burn it, and then we give you medication, and then in worst cases they get surgeries done for them, just like the cervical cancer.
Okay, so what do we have on the table today?
Okay, so on the table today we have a dummy. This is just representing a female reproductive system. And so the vulva, that's what we see on the outside. And then the vagina is inside. So inside the vagina is where we have the cervix. So the cervix is not something you see it, but you would have to use something to visualize it, and that is what we call a speculum. So
you're going to demonstrate for us?
Yeah, so it's a speculum bit that makes the screening uncomfortable. That's how some people are not screening. So this is a speculum. This is how we have it. So you go in like this, and then when you enter, you have to bring it down. So when you bring it up, it opens up.
Opens it up.
So when it opens it up inside, the cervix becomes visible to the eye.
Okay.
And so with this, you can now take your sample with, this is the slide we use for the pap.
Okay.
So
this is what will happen to you if you were to go to
the hospital
to get examined.
You lie down as if you are going to deliver, and then we insert the speculum.
Okay.
And then when we insert the speculum, this is a sample of the pap kit.
Okay.
So in the pap kit we have the brush, and then we have the cotton tip, and then we have this. So
what is that?
It's a spatula, and then we also use it to scrape the cells at the cervix.
Okay.
So on the slide we have a portion for the spatula and a portion for the brush.
Okay.
So this one will scrape the outer part, but the brush will enter into the cervix to turn
so it be in the womb.
It doesn't get into the womb.
Okay.
You know, the cervix also has a little length. It's a little bit longer.
Okay.
So you insert the brush into the hole, and then you turn it, and then you smear it on the slide.
All right.
And then you use the spatula to also go in a circular motion to scrape cells at the cervix, and then you smear it on.
What's the idea of why the difference? Why do you use a brush and the spatula?
We want to know the extent of where the cancer has gotten to, because there's a measurement. So if you say CIN1 or CIN2 or whatever, I want to know what's the extent of damage, if there's a lesion, to what extent has it affected the cervix. So, because based on the extent, that will determine your treatment option.
Okay.
Some will need just a cryotherapy to freeze it, and then we are ending. Some will need a surgery. We have to cut a portion of the cervix, or some will even need a total removal of everything. So
when you say everything,
like the cervix, or sometimes even the uterus.
The entire uterus.
The entire uterus, yes.
Wow.
And the whole process is painless, right? You don't feel...
Painless, yes. It's just a little bit uncomfortable when you are inserting the speculum. And then what happens is there are some women, their cervixes are not well posted. Like some is way up, some too is very down. So when you go in and you are searching to get the cervix, that's where they feel a little bit uncomfortable, but it's not. It doesn't hurt.
Okay. So it's just invasive.
It's just invasive. It doesn't
painful
hurt.
at all.
It's not painful.
That's good to know.
And so this is cotton swab for the VIA.
Okay.
So you dip this in the acetic acid. That's a normal vinegar we use at home.
Okay.
And then when you clean the cervix, if a lesion or something is occurring, the color will change.
Of the cotton there?
No, at the cervix. The cervix is supposed to be a pink in color.
Okay.
So when you apply the acetic acid, sometimes it becomes whitening.
Okay.
Instead of pink, the color changes. So we say aceto whitening. Is it thin or dense? How thick it is depends, how deep the precancerous lesion is going on. And so you take a pap to the lab, and then we see about it. And
so this one, can you do it yourself, or you will need it? For this one, you will need
the pap smear, the VIA, and the colposcopy.
You need a professional.
You need a professional because we have to visualize the cervix before we can take the samples.
Okay.
Yes.
Okay.
So the last one, which is the HPV DNA testing. This is the Evalin brush.
Okay.
And with the Evalin brush, it's a cell sampling.
Okay.
Okay.
So when it's handed over to you like this, you go to the washroom, you wash your hands, and then you open the cover. So when you open the cover, you open it. When you press the top here, it opens automatically.
Okay.
This is what you're going to use to take the sample. So your hand is not supposed to touch the upper part.
All right.
You put one of your feet on top of the pot.
Okay.
It automatically drops your cervix into the vagina.
Okay.
And then you insert the Evalin brush in. Now when you insert it in, it will come and lock at the, so when you insert it in, it will come and lock at the
tip of
the tip. That's the vulva or the majora. So when it's inserted in a standing position, so the client is taking the sample herself.
So you'll be like this.
Exactly. So you'd be like this, and then it will be inserted in. So it locks up here.
Okay.
And then you hear a click.
Okay.
So when you hear a click, you will turn it, and then at each turn, you also hear a click.
Okay.
So you turn it for about 5 times, and then you pull it out gently.
Okay.
You see, so the brush up there would have scraped the cells.
Okay.
Yes.
Okay.
So when you bring it out, then you pull the plunger back in. But make sure your hand does not touch where it is, and then you cap it back.
And then you're done.
Then this goes to the lab.
Then this goes to the lab.
How many minutes is this?
Oh, less than a minute, you are done.
Okay.
And this is painless because you are not going to visualize yourself. You are not going to lie down.
Yeah.
You're actually taking the sample yourself. In the absence of the Evelyn brush, we can also use the high vaginal swab stick, and it serves the same purpose.
Okay.
So you also turn it this way to open it. But first of all, because it's self-sampling, what we stress on is hand washing.
Okay.
Yes. So you wash your hands first, and then you bring it out.
Okay.
You also,
And then you stand again.
So that looks like a cotton swab.
yes, it's a cotton swab.
Okay.
It's also pixels.
Okay.
Yes. And usually when you stand, your cervix drops well. And so you insert it in
That way. Okay.
and then you turn it in there. Because this is not a brush and it's a swab, it doesn't, you need to turn it for about 10 times, unlike 5 times of the Evelyn.
Okay.
So that because this one has a brush, it's able to take,
It
picks more cells. But this one, you turn it for about 10 times, and then you pull it out gently, and then you cap it back. You bring it to us, and we take it to the lab.
Super.
And that's it.
And that's it.
Wow.
So this is HPV DNA testing. That's what we are pushing, so that the busy people,
I think it helps more for the people who just don't like the whole invasion.
I know.
You know, I think I don't know if business is really an excuse for taking care of yourself, but I think it's more of the fear of pain or the invasiveness of other procedures, which hinders people. So I think this is a brilliant innovation. Yeah, it's such a brilliant innovation to make it easier.
To make it easier
For everybody to get tested.
So we'll mail your results, and what you need to know is that when you're negative for HPV, we advocate for vaccination.
Okay.
Because we don't place much premium on preventive.
Okay.
We are looking at preventing. Okay, so you are negative. Let's build immunity against the virus, because it's with us.
Yeah.
And you never know. And the mistake we mostly make is that, they're sexually active. No, that's why we get it all wrong. You might not be sexually active, but on someone's fingers, you can get infected. A mother can pass it on to a baby being born, because if the mother has cervical cancer and then the baby is coming through the cervix, what happens? And because all these things are at risk, that's why we want to place much premium on the screening. And because the cancer itself is asymptomatic, you don't really have much symptoms until you are in the advanced stage.
Yeah.
We are advocating for this so that you can screen in the comfort of your home or office. And then once you know you are negative, even if you are positive, there's still hope. Because if we see it early, you are able to benefit from less painful treatment, and then you are sorted. Yes.
But it seems rather scary to me in the sense that it means that you can have it and pass it on without ever knowing you have it.
Exactly. That makes it more dangerous.
That's scary.
And the virus can persist, as I said, between 10 to 15 years before even the change at the cervix will be seen. So if you are a carrier of the virus, and you may have a partner who might have a partner you don't know.
Yeah. Which is usually common.
So
Lord.
we don't want it, yes. So then that's how come we're also not placing premium on only sexually active.
Yeah.
Because, there was no penetrative sex, but he fingered me. HPV can be carried on the fingers. So you can't tell. That's how generally, let's screen. And then the good news is that children below 14 years who are not sexually active or who haven't come in contact with any kind of sexual part can be vaccinated without screening. because it's assumed you've not been exposed.
Yeah.
So we want to build immunity before you come in contact with even the so. And with that vaccination, it's done for both boys and girls.
Yeah.
Okay.
Because a man can pick the virus and give to another woman. And a man can also get the genital warts, which is the low risk type.
Yeah.
And so we advocate for vaccination in less than 14 years children, both males and females.
Okay.
And then with the adults, screen. And then once you are negative, you live a good life, like you modify your lifestyle, and then you also get vaccinated.
Okay, so walk us through, for the parents who are watching, how important it is for their kids to get vaccinated immediately, and even how much the procedure is to get the vaccination.
Okay, so we have two types of vaccines.
Okay.
We have the Cervical vaccine, which prevents only the high risk type of HPV. And then we have the Gardasil. The Gardasil gives protection against the high risk and the low risk, which causes genital warts, and which affects both sexes. That's how come we're saying both males and females should be vaccinated. And at times, the peer pressure and curiosity, our younger ones, they go into these things without their parents not knowing. And so you would want to do that as a preventive measure for your ward before you are hit by any surprise, because they do things we are not aware. And so as a parent, you would want to give protection in case he or she does it on your blind side. At least there's a protection somewhere. And so, and even when we do that as a nationwide, some years to come would have provided a herd immunity, because a certain generation would have been all covered. And so in some countries, it's part of their routine immunizations that the government is a policy. So every young girl has to go through it, but not in Ghana now, which we would advocate that the government can enroll it as part of the expanded program on the immunization, because cervical cancer, it's more deadly.
How much is the vaccination?
It depends on facility to facility.
But what's like the range?
But it ranges between 250 and, let me say, 400.
250
Ghana cedis.
Ghana cedis are 400. So we're
Ghana
talking
cedis.
about averagely, let's say, $50 to about maybe just under $50 to about $80, somewhere there.
Like that.
Yeah.
How often do you need to do it?
A shot.
So if I give my child at 13 years, they get the shot. They have to do it.
No, they will take 3 doses.
Okay.
So when we give with the Cervical, when you immunize today, you repeat or you take the second dose in a month time.
Okay.
And then the third dose will be 6 months from the first dose, or 5 months from the second dose.
Okay.
With the Gardasil, when you take it today, you take the second dose 2 months after, and then 6 months from the first dose, or 4 months from the second dose. You take the final, and then
the child is set for life.
Exactly.
They don't have to worry about cervical cancer.
Later in life, you can go for a routine screening, because even those who are negative, we still would want you to screen, let's say, in every 5 years or in every 3 years. Depend if you use the HPV DNA, you can go every 5 years. But the PAP, you would want to do 3 years, because if the virus is there, the PAP will not pick. No change has occurred at the cervix, so
enough for it
to pick. And so so we build that immunity, because you might be negative for the type 16 and 18, which causes cervical cancer, but you might be positive for other types of the HPV. That's how come, as for the screening, we are advocating that it's everyone does it. Yes.
Yeah. And you said that the vaccination, what's the shortest period that it lasts for?
Ideally, it should give a lifetime protection.
Okay.
But our immunity differs. You know, we have an HIV mother who tests negative for cervical cancer, but due to her immunity, which has been compromised because of the virus, this person will take the vaccine, but will even be screening every year. We advocate. So, and then even individuals, due to our background, and our immunity differs. So ideally, it has to give a lifetime protection. But then, sometimes one will say, oh, I want to take just a dose as a booster.
Okay.
And then when one is 50 years upwards, we don't recommend vaccination. People who are even 60 years take it. We are not saying you cannot.
But you don't necessarily push.
Exactly, because your risk is lower compared to the younger person now coming up to be sexually active.
Okay.
Yes.
Okay, so is it because the sexual activity has dropped, or is it because hormonal changes has also happened?
Hormonal changes also plays a role because naturally 50 years plus, menopause is setting in, and so libido dwindles a whole lot, and usually they go through the crisis that their attention isn't even on sex. And you know, these things, the hormones also feed them. It nourishes in a way. So at that age, their risk becomes lower. Yes.
Okay. Now, we have this notion of what you don't know won't harm you. But when it comes to cervical cancer, what you don't know will literally kill you. So tell us again how important it is for every single one of us, especially the women, to know our status as far as cervical cancer is concerned.
Okay, so it is important for every woman to know her status. Or let me put it, for want of a better word, to know her status, because I said the virus, when you come into contact with the virus today, it can hide between 10 to 15 years. And because that's you might have even forgotten how you came into contact with it. And because all these years, it's not going to present any sign or symptom like malaria for you to know what to do. It is important that you screen. That is what we are advocating for. Yes.
Okay. Now, you came earlier this week, and myself and AJ had the privilege of getting tested. And we'll be showing you guys that shortly. But if you have any questions for Akua as she's here, this is the time to ask. If you're worried about your wife, your partner, your daughter, your mother, and you want to ask her a question, we will be really glad to ask her on your behalf. The hashtag to use is Breakfast Daily, and the supply. And
also send us WhatsApp messages. We are ready to receive and read them out to her for her to answer for you. It's 0550-585832. The number is also on your screen. So if you are outside the jurisdiction of Ghana, you can use the international code as well.
Yes. So we'll be taking a look at what we did shortly. But for people who might be wondering, the cost involved. So you walked us through different types of testing. How much do they cost, so that we can put things into perspective, and you at home will know that you can afford at least one test on this table.
Yeah.
It depends on the facility.
Okay.
My team, for instance, we are a mobile team. We don't have an office. Sort of. Because we can't sit in the office waiting for them to come all day. Now want to come to you. So we are a mobile team. So we give out a number, and then anyone can reach us, and then we can screen. But some people in the basic one, at least, which is the VIA, in most communities, some even screen as low as 3 Ghana cedis.
And that's this one. Yeah, take
that's
it out
this
for us,
one, yes.
Okay, so this one
into the acetic
what's
acid.
as high as it can go? What's the range that you pay
15
for something?
cedis
15
or
cedis.
30 cedis.
So if you're a family member in the rural area, far from us, who might have some budget constraints, this is the one.
This is the one. Okay. Because sometimes when you even go for outreaches, we do it for free.
Okay.
We do it for free. And sometimes you get to see the acetyl whitening, and we refer. Because they will need a pap to know the state, what is really happening.
So poverty is not an excuse to not get tested.
Exactly.
Because you can afford this.
You can afford this at least on the minimum. And in worst cases, we can do it for free. Yes. Because when you buy one vinegar bottle, like 5 cedis, it can screen about, let's say, 20 women. So if you buy it for 5 cedis and you are even charging 1 cedi, let's say the cotton wool, the stick, everything costs 15 Ghana. You still get like 5 Ghana.
So the women who are watching us from rural Ghana, they can just go to any facility,
government health facility. And this, I would also want to say this here, that there's a cervical cancer and prevention training center in Bato, Catholic Hospital in Bato, and they are doing a very wonderful job training health workers, nurses, midwives, PAs, so that we can, because it has to be a nationwide coverage. So Dr. Ifa and his team, they are doing a wonderful job training health workers so that they can screen anywhere in the country. So in the rural areas, they organize outreaches, and those who have gone for the trainings, we partner with some institutions, and then we organize outreaches for the rural folks. And basically, this basic one, they benefit most.
So you can just go to any. Where should I go to if I'm watching from my home and I'm in some village? Is it a hospital I go to, or
if you find yourself in any health center, a CHIPS compound, at least the health worker there will be able to offer the basic assistance, and then you might, where you need a better way, to refer to the next line.
That's
very affordable.
Excellent.
Yes, and then we come to the PAP.
So
the PAP is the next one.
This one.
This is a speculum.
It's it's slightly uncomfortable, but it's not so unbearable. I actually, my first time testing for cervical cancer, this is the one they used on me, right? So they literally just insert it in, and then they open it to get some space, and then they put the swab inside, and then it's painless, extremely painless, but then at least you get to know your status. And they do it in like 5 seconds, and you're done. How much will this cost to go to the hospital to get this test?
It depends on the facility. Some charge 100 cedis, some 80, some 120. Because
so
sometimes
from like 100 to 150.
Exactly. And then the thing is that it's the centers that we run the labs. That's what makes the cost expensive. Because if someone has to bring her sample all the way from, let's say, Asin Fosu to standard boards in Accra, the cost of transportation compared to me in Accra here sending my samples to stand, so that brings the variation in the cost. Yes, mostly because of where we find ourselves. Yes,
and then the rest.
And then
so the rest are the ones that you guys have innovated that you can do yourself.
It's there. When you go to Bato, you can also benefit from the self-sampling method because they have the machine that's run the lab, and then.
What's the price range for this one that you do?
This one, let me say, it ranges between 150 to 300. Depending on your location.
So if you don't want someone to invade your space, you don't want to go to have a health official look in between your legs and inside your lady thing. No, because some women might genuinely not want to do that. But they don't
an emergency. They are not bleeding. They are not dying. So why should you
go there?
But then
you can just get this.
Yes, but then when you test positive for the self-sampling, it means we'll still have to pass the speculum as a second stage.
Which is a very simple. I mean, get used to health professional. You see it every day. So if you see mine, you don't even remember it by this afternoon. Would you know? Be honest. Would you remember it when you see me tomorrow? I wouldn't, because there are a lot of work. You'd have seen like 100 by tomorrow. No, because some women overthink it. That, if I'm going to see a cure tomorrow, she'll be looking at me in a funny way.
And the funny thing is that we have a lot of gynae doctors who are males. And our women are so comfortable with them. But even going for a midwife or a nurse to use a speculum to look at your service, and we think it's so.
Well, I can appreciate that, because I think that it's the whole thing of you and I have one. You and I both have the same. So you are comparing, and then I'm imagining what you'll be thinking.
You look so pretty, this is what you are carrying. But please, let's not use that as an excuse to not get tested on a very serious note. Now, you don't have an excuse, because some women will say all kinds of things, but you can test it yourself. So, yeah.
Yeah, I wanted to find out. So, since how long have these self-testing methods been available? And since they became available, how has that impacted the advocacy?
Well, it's been there for quite some time, but as I'm saying, the center at Bato, they were actually running the labs nationwide. So,
I see.
Yes, and then Kolebu has the machine, but sometimes we're also looking at the volume, the numbers. So once other methods other centers can do it and get the results within a shorter possible time. This wasn't, and then the cost involved, because the reagents using to run this, it costs. And most of them, you have to import them. So we don't want to take samples and then we run out of reagents to run them. So then we stick to, the ones that we can always get the reagents to do. Also, because of the cost, it's not government subsidized. Unlike, because the Ghana government has a policy on cervical cancer, actually, which gives the kind of screening methods each one can get per your age, and even the kind of treatment you can get. But then, even with healthcare, as it behoves on the provider, what will be best for you is what we discuss, and we don't have to impose. We let you know the treatment options available, and then you make an informed choice. But in the worst cases, sometimes you are not given a chance to make a choice, because if we're not taking the whole uterus out, we'll prevent it from getting to the lungs or other organs. Then would let you know and then take it out to save you, because few people, after even the painful and expensive treatment, will go beyond 5 more birthdays.
Wow.
Yes.
And that's it.
That's it.
Wow.
We're still talking to Akua Nuamah, who is a midwife and a public health nurse. And the conversation is all about cervical cancer, It's something that can kill you. It will kill you. So it is very, very, very important for you to get tested. And of course, it's still an interactive show. So if you have any question for her, let us know with the hashtag #BreakfastDaily. The WhatsApp line.
The WhatsApp line is 0550-585832.
Cervical cancer is killing too many of our women. We had some doctors actually here earlier on who said about 3,000 women were diagnosed last year and 2,000 of them died, right? Because at the time you finally see the symptoms, it is too late for you to actually treat it. So we want more women to focus on prevention so that we don't die of something that's preventable. She's gone through all the methods here with us. None of them cost more than 200 cedis. The cheapest one is about 10 cedis, 15 cedis. So we really have no excuse to not get tested.
Are we winning this battle?
Not as we want it.
What more can we do?
Education. And then also for the government to also come in and step up their game, because it's not just about designing a policy. What goes into it? How are we ensuring that implementation of those policies? So can we make it a mandate that, and that's what Dr. Dziffa is really pushing, at least every health facility will have a screening unit with a trained personnel to pick up at least the precancerous lesion. And then if you pick it up early, you refer for better management. So at least irrespective of the location, once there's a health facility, can we have at least one health worker who has been trained, who knows what to do when it comes to screening, or who even can train other health workers so that we can screen everyone, because we are not winning it as we want, and it behoves on us, because we're not placing premium on the prevention. Yes.
Okay, so we're going to talk viewers through the whole process of at least doing the self-testing one. And so they're going to see on our screen 2 young women testing it. So we'll walk you through as you go. So let's take a look at that, and then we'll talk you through what you're looking at. As you're seeing here, AJ Kwaku Sapong is there meeting Akua with another Akua there. So they sit down. She walks them through really what you saw here on your screen. And this is how it's going to happen if you were to meet one of Akua's colleagues at your office or your home to walk you through how to test yourself.
Okay, so then she takes out the self-testing kit, shows them exactly what to do, just like she showed us here in the studio. So she shows them what to do there, explains the procedure, what they need to do once they get into the washroom, what it is that they would have to do there. And just as she demonstrated on the set, you can see that.
So here she's telling us actually that you have to turn it 10 times once you insert it in. It's very, very, very important that you wash your hands before you do the test. And you also don't touch the tip of the stick that she's holding there. So once you insert it in, you turn it around in the same direction 10 times. So as you can see
So
there,
off they go.
We're in the bathroom now. And it takes like maybe 1 minute, really. Well, you need a 1 minute to wash your hands thoroughly, and then another minute to do the test.
And
then
here they
done.
come.
You're done. You can do it at home. You can do it in your office.
What were you guys smiling about?
Oh, at how easy it was, because you know, inserting something in is always weird. But of course, when you're done there, then you fill out the forms. You need to know your medical history. It's a very simple form of asking if you've done the test before. What else did you ask on the form?
If you've done it before, what was your results?
Exactly.
And if it was negative, if you vaccinated before, what type of vaccine?
Yeah.
And then if we identify, sometimes, you know, going through the treatment, you need a support. And so we ask contact information for the, in case of emergency or in case of who to contact. Basically, that's all.
So now we gave our results back to Akua, who asked us the feedback of, the test that we did. So we just gave it back to her. And then what happens once you take it from us? You now go to the lab.
Yes, and then run the test and then bring you your results.
How long does it take to find out the results after we do the test?
Maximum, we say in a week you should have your results. And you don't need to come, just as we can mail your results to you.
Okay.
Yes, and so that's how come we take
about convenience.
Exactly. So that's how come we take the biodata, so that we can mail your results to you. And then those that need further screening or further discussions, we engage them. And
I have my results.
You're going to show this on air?
Of course.
Okay.
We're family, aren't we? Okay. We're one family.
That's
so it says my name here. It says my age. Yeah, so there you have it. And, you know, what's target 1, target 2, target 3?
It actually talks about the types of HPV.
Okay.
So we're looking at the high risk, the low risk, and the other types.
Okay.
Yes. So, but you know, it's a medical thing. And
but then on the right side of our viewers,
you have a curve.
I see a curve. What is that? And it's very high. So I'm like, am I close to almost getting it?
No. You are not. Your test says you're actually negative.
Ooh.
And so this is a normal curve.
Oh, this is normal.
Yes.
So you're looking here is normal.
Yeah.
And if it had been abnormal, I would have shared it with you guys anyway, because there's no shame to it. It's important to know than not know.
Yeah.
Right? So it doesn't matter.
And once we know, we support you.
Exactly. You know, and so this is it. So what's the next step? Once I find my result?
Once you find out you're negative, you take the vaccine.
Okay.
To build immunity against it. And so with the immunity, you know, you can come in contact with the virus, but you will not suffer from the disease.
Okay.
Yes.
Okay.
So we take it, and then let's say after 5 years, you get to screen again.
Oh, okay. So 5 years, I'll see you again, and then I'll screen again.
Yes.
That's if you take the vaccine.
I will take the vaccine, because if I don't take the vaccine, I might get it.
Yes.
So I can't
Even today,
I can get it if I decide to be experimental today.
You are
which I'm
negative
not
today, and then you never know what will happen tomorrow, and so you might be exposed. That's how come we don't want you to hesitate. Once you're negative, you take the jab, and then prevent.
Nice.
Yeah, you've walked us through
this has been fantastic.
Much now. Our viewers who want to contact you to find out more information so they can get tested and share their results with us, where do we reach you?
Okay, so they can call on 055 2388 260. 055 2388 260. And we'll discuss whatever. If they want to also come to, because some want to take the PAP, and we still have a center, so we can, when they call, we'll let them know where to come to, and then we screen them.
055 2388 260.
Yeah.
Fantastic. We've been speaking with Akua Nuamah. And she's helped us to understand all the ins and outs of getting tested for cervical cancer and the HPV DNA testing and all the different kinds of testing that they are, just to make sure that you stay healthy, and that in case you don't have it, you can get vaccinated and you're not going to get it. In case you already have it, then at least we can catch it early and make sure that we treat it and you're safe.
Yeah, because we do need to save our women from cervical cancer. Hi there. We hope you enjoyed the show.
Make sure to subscribe Like, comment, and share with your friends.
This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.